The September 26, 2017 meeting of the Human Services Committee will now come to order. Will the clerk please call the roll?
Vice Chair Brown.
Here.
Dr. Carbone. Here. Mrs. Conley. Here. Mrs. Draw. Here. Ms. Harris. Here. Mr. Hebert. Here. Mr. Lightfoot. Here. Mr. Moyo. Here. Chairwoman Taylor is excused. President Daniele.
Here.
Is there anyone signed up for the public forum?
There is not.
Is there anyone present who is not signed up to speak who would like to address the committee at this time? Seeing none, we will conclude the public forum. The next item on the agenda is the approval of minutes. You have the August 22nd, 2017 minutes before you. They will stand approved unless the clerk is notified of any changes by the end of the day. The next item on the agenda is new business. Madam Clerk?
Referral 17-0264.
Moved by Legislator Conley and seconded by Legislator Hebert. All those, I'm sorry. Is there any discussion? Legislator Conley?
Thank you, Madam Vice Chair. Through you to the administration, can you tell me how the school districts were chosen to participate in this grant?
Through the chair, we contract to the University of Rochester in this research project. This is a 6-year in that. They select the school districts that we contract to provide the service to.
Thank you. And through the chair to the administration, can you tell me what the process is for having students sign up to receive the vaccinations?
Through the chair, there's a combination of efforts. Some include sending good old traditional paper consents and information home in the backpacks. Some include online consenting. They all happen about a month before we go in. We receive those consents. We check their insurance. We check all their information about do they really need the vaccine. We go in and administer in the school.
Thank you.
Is there any other discussion? Legislator Harris.
Thank you, Madam Chair. To the chair, to the administration. I see that the additional funding is a little over $29,000. How many staff will this cover with salaries and benefits?
Through the chair, that covers a piece of an RN and an LPN in the immunization program, and it also covers the contracted nurses that we utilize to ramp up for this project for very short term per diem, and that will be directly based on how many children consent.
Thank you. Through the chair to the administration, if you could, if you could tell me, how do you guys evaluate this program? I mean, I saw that in the referral that it talked about this will also cover the evaluation as well. How do you guys do that?
Through the chair, there's a complicated process where we compare the New York State immunization records of the school where we are to a school that is matched to it, that is similar, and identify the rate of immunization for flu vaccine in one school compared to the other.
Thank you. One final question. When will the dissemination of the flu vaccines begin for this period?
Through the chair, we will actually do our first immunization the Monday after Thanksgiving.
Thank you.
Is there any other discussion? All right, all those in favor, please signify by saying aye. Aye. Any opposed? Item carries. Next item on the agenda.
Referral 17-0265. Amend resolution.
Moved by Legislator Hebert, seconded by Legislator Draw. Is there any discussion? Legislator Harris.
Thank you, Madam Chair, to the chair to the chair, to the administration. For this particular resolution, is there a set amount of this funding dedicated to women, infant, and children in the WIC program? And if so, how much?
Through the chair, the total funding for this, the full funding, the total amount of the grant, it's a 5-year amount, is $11,497,649. This referral is for a cost of living allowance that the funder is providing for us of $181,138.
You said, can you repeat the amount to the chair, to the administration? Can you repeat that again? I'm sorry.
Through the chair, sorry. The full 5-year grant amount, $11,497,649. And this cost of living allowance, the additional funding for this grant year is $181,138 added to the original grant amount. That gives the total that I just gave you, the $11 million total.
Okay, thank you for clarifying.
Is there any other discussion? Okay, all those in favor, please signify by saying aye. Aye. Any opposed? Item carries. Next item on the agenda.
Referral 17-0266.
Moved by Legislator Draw, seconded by President Daniele. Is there any discussion? Legislator Lightfoot.
Thank you so much, Madam Chair. Madam Chair, I have a question regarding this referral 17-0266. Through you, Madam Chair, to the administration. This referral is to amend, so it's already in effect, and increase the contract with the University of Rochester for one of our health departments to help track or administer services regarding sexually transmitted disease in this program and so forth. And through you, Madam Chair, to the administration, I was trying to determine exactly where this would fall or deducted from our budget. Although some information was given to us regarding the general fund number and the fund center, when I tried to look at the actual paper budget or electronically, I'm having a problem really understanding what line item it is being deducted from. So through you, Madam Chair, to the administration, is the administration able to instruct me on how to determine where specifically this amount of funds to be deducted is found in our budget book? I did start on page 564, so if you have something or electronically or whatever, if that helps.
Madam Chair, if I can just clarify, the question is, where is this funding being deducted from the budget? Can I clarify, is the question, where is the appropriation that supports this payment?
Yes, so it will be on the, like in this budget, the headline says item description. I'm assuming it would be something under contractual services or something and so forth. And all these fund center numbers really don't line up with what I'm looking at in the book, so in the budget book. So I'm just trying to see how they correlate, if you're able to do that. Did I answer your question to you, Madam Chair, to the administration?
Madam Chair, I'm clear on the question. These referrals are very detailed in terms of the cost centers being charged. The Tuberculosis Control Program, Fund Center 580202, is within the Nursing Services Division. The appropriations that will allow spending on this contract exist within Department of Public Health, Nursing Services Division, and as the legislator speculated, the appropriation for contractual services.
So through you, Madam Chair, would it be under agency contracts like 504-800? Through you, Madam Chair? Because there's a total of, let's see, $1,260,000, I believe, and some change allocated.
Madam Chair, contracts such as this are typically budgeted as agency contracts.
Okay. Typically on this particular case, so, all right, thank you.
Is there any other discussion? Legislator Moya?
Thank you, Madam Chairwoman. Through you to the administration, has there been a rise in tuberculosis cases that necessitated this increase, or is that another cost of living type increase?
Through the chair, the number of tuberculosis cases has remained relatively stable for the last 10 years throughout the county. The role of this funding is to provide a nurse who can be in a multitude of settings, the TB clinic, the immunization clinic, the HIV/STD clinic, which are all located in different places, to be kind of the hub to connect all the patients that are the same so that we're not duplicating services or care.
Okay, thank you.
Is there any other discussion? Legislator Lightfoot?
Thank you so much, Madam Chair. So back to this budget question, just so that I learn, so I don't have to really ask these questions in the future, through you, Madam Chair, to the administration, the particular referral has some information into it, and I may have it in front of me because with our new laptops here, I had the budget up. So it tells me that the general fund, through you, Madam Chair, to administration, general fund number 9001. So what does that tell me in reference to this budget document? How will I use that to look up this information in the future, through you, Madam Chair, to the administration?
Madam Chair, as legislators review the budget book at budget time or throughout the year, they will find sections for each department within the county. For referrals dealing with public health, legislators can refer to either what I would describe as front or middle of the budget book and find the budget section for the Department of Public Health. And when reviewing a referral, pay special attention to the funds center. In this particular referral, the funds center being referred to is 5802, and then another long string of numbers. 5802 is representative of the Division of Nursing Services. Legislators should be able to find within the Department of Public Health the Division of Nursing Services specific budget. Legislators could also look towards the back of the budget book where we have a detail section of departmental appropriations and departmental revenues. The appropriations detail is often broken out by division. And at least for the Department of Public Health, because it is such a large department and an operating department, those divisions are delineated throughout the pages of the appropriations detail, and a legislator should find towards the top of the appropriations detail the division 5802. 5802 would encompass all the appropriations for the subdivisions and various fund centers within the nursing program.
So thank you. And so the additional, through the administration, can you turn him up a little bit next time, please? Because I can't quite hear. So in addition to the additional string of numbers that we found on the tail end of 5802, which is another 6 digits, I can find those references in the rear of the book. Is that you correct, Madam Chair, through the administration?
Madam Chair, the legislator should find
Thank
the
you.
division for 5802 in the back of the appropriations detail.
I think I'm turned to that already for public health and 5802, so I was just looking for those string of numbers and just how they kind of correlate within the book. That's all. Thank you so much.
Is there any other discussion? Okay, all those in favor, please signify by saying aye. Aye. Any opposed? Item carries. Next item.
Referral 17-0267, accept.
Moved by President Daniele and seconded by Legislator Carbone. Is there any discussion? Legislator Moyle.
Thank you, Madam Chairwoman. Through you to the administration, the statement is that this is to reduce the backlog. What is a current wait time for a toxicology report at this point in time?
Through the chair, the backlog and the wait time vary based on the complexity of the case. There are some cases that don't take very long because they don't have a lot of drugs on board that need further testing. However, some of them are highly complex and require a great deal of additional testing to obtain all the necessary results, and those cases take longer. So it really varies considerably from one case to another.
Okay, thank you. And through the chair to the administration, would reducing the backlog mean more testing of the complex cases and doing it more quickly, or is that a lack of technological resources?
Through the chair, it's kind of a combination of both, because we have certain instrumentation that we need to evaluate different analytes, and we can batch our cases as much as possible, but the instruments need a certain amount of time to run. However, staffing is also important in terms of accomplishing the variety of analyses that we have, so both are factors.
Okay, thank you. Does this grant allow us, the crime lab, to buy more equipment, or is this updating current equipment and personnel through the chair?
Through the chair, it's the forensic toxicology laboratory.
Oh, excuse me, I'm sorry. Thank you.
Also, to address the question, this is not a grant that purchases instrumentation. It allows us to maintain our current instrumentation. So it provides a maintenance contract that prevents a breakdown of an instrument from keeping it out of service for an extended period of time. And it also partially supports different personnel in the laboratory.
Okay, thank you.
Is there any other discussion? Legislator Conley.
Thank you, Madam Chair, through you to the administration. Can you tell me who actually maintains the liquid chromatograph mass spectrometer? Is it a county employee, or we contract with somebody to do it? Through the chair, day-to-day maintenance is accomplished by the analysts who work on the instrument. However, if something more substantial needs to happen or routine preventive maintenance has to occur with the vendors that produce the instrument. So large-scale maintenance is done, and that's what the service contract is for. More substantial maintenance, not the day-to-day stuff that our analysts can do themselves.
And thank you, and through the chair to the administration, who's the vendor then?
In this case, it would be AB SciX.
Can you say that again?
Through the chair, in this case, it would be AB SciX.
Thank you.
Is there any other discussion? Okay, all those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 17-0268.
Moved by legislator Carbone and seconded by legislator Conley. Is there any discussion? Legislator Harris.
Madam Chair, just a few questions. I'd like to start off by asking, why are we targeting, is there a reason why we're targeting one neighborhood, and which neighborhood is that that you're targeting?
Through the chair, we are not targeting that neighborhood during the first year of the grant, and that neighborhood has not yet been determined. The process for determining which neighborhood is going to be based on information that we gather during the first year and on developing neighborhood groups, focus groups, determining what neighborhood might be interested in taking it further.
Oh, okay. Thank you for the clarity. Can you, through the chair to the administration, can you clarify or tell us the time frame of when you're planning to roll this out? Or, yeah, explain the, the process and time frame.
Through the chair. So we're in the first year of the grant now. Some activities have already begun. The mapping activities that are mentioned on the referral, we are gathering information about indoor spaces within neighborhoods that people could use. And when we gather that information and collate it, we're going to provide that to local healthcare providers so that they can give that information to their patients.
Thank you. Thank you. Through the chair to the administration, is there a particular reason that this particular grant focuses on one neighborhood, or the plan is to focus on one neighborhood?
Through the chair, that was a program designed by the University of Rochester. They are actually the lead agency. They are the owner of the grant, so to speak, and they're subcontracting to us for this piece of it. Our part of it is to develop the neighborhood information, the locations of places within neighborhoods. And so we did not design that piece of it. So I can't really speak to why they decided to focus on one neighborhood.
Through the chair to the administration, thank you for clarifying that. Is there, I guess I find it, I'd like to know, what's the, strategy, or what was the mindset behind it. I didn't know if that's something you can get back, ask them and get back to us with why one neighborhood was, or one particular neighborhood is going to be targeted. I'm just very interested for just learning about this new intervention.
Through the chair, I can certainly get more information. What I can tell you is that it's not unusual to focus a particular activity in this manner in developing interventions for health improvement. It's been done for other projects, and part of it is a demonstration of where there is neighborhood interest and where there's neighborhood motivation and increased activity. Part of the goal would be to demonstrate that that increased activity within a neighborhood can have an impact on the health of the neighborhood residents. But again, I'm not the one who designed the project, so I can't say for sure that that's the bottom line reasoning.
Thank you. I just want to clarify why, I guess I'm looking more of, have they decided, through the chair to the administration, are they targeting neighborhoods that they suspect have high risk of diabetes or, inactivity, that type of thing? That's what I was looking at. Through the chair to the administration, will the county receive results directly from the grant administrator once this whole process is complete that you can share with the legislature?
Through the chair, yes, there will be data gathered throughout this process, and one of the objectives is to identify those neighborhoods who are lacking in resources, whether it's exercise resources, nutritional resources, healthcare resources, so that we can identify areas that need more intervention. So yes, we will get that information and we can share it.
Thank you. And final question. As you look at this data and this information, is there at least an intent from the county to plan to act on, trying to mitigate some of the challenges as a result of what you will find?
Through the chair, it is one of the objectives of the Department of Public Health to have an impact on chronic disease in the community. However, it's all, as you know, based on funding. We will do what we can do based on the amount of funding we get for each project.
Thank you. Thank you very much.
Is there any other discussion? All those in favor, please signify by saying aye. Any opposed? Item carries. Are there any other matters to come before this committee? There being no other matters, the September 26, 2017 meeting of the Human Services Committee stands adjourned. The next meeting of the Human Services Committee will be held on Tuesday, October 24, 2017 at 5:30 p.m.